Good afternoon, everybody. I'm Varona McCall. I'm a public health nurse and a lactation consultant. So that is a breastfeeding specialist. So nutrition, that is one of the most important things that is the first nutrition for children. And when they become adults, then you definitely see the benefits, long term. Um, so I'm gonna talk about, a little bit of breastfeeding. If anybody's in here who has children, knows somebody who's having children. I work for the Department of Health Women, Infant, and Children program, so the WIC program. And we have one of the agencies located right on Nassau Road in Roosevelt, 380 Nassau Road. That's the new building where the clinic is located and a few other, the counseling center, the REACT center. So there's a few places housed in that building, but WIC is one of the places. So we service women who are pregnant, women after they deliver, up to a year. So once the baby turns a year, if women are breastfeeding, they can stay on the program until the baby turns a year. And infants and children up to 5 years old. So once they're 5, that's it for the program. But it's really, really important that we educate the community about food choices. So I'm not here to tell you, you need to eat this or you don't need to eat that. But, he was talking about organic foods. At home, I grow some foods on my own. So we do the peppers, we do the cucumbers, the tomatoes. And you don't have to live in a big house with a big yard. You can have some soil in a windowsill, right? Exactly, in a box. And you can try to grow some of your own, fruits and vegetables on your own. My son is right here. He goes outside and he picks up the cucumbers and eats the cucumbers. He picks his strawberries, he eats his strawberries. So those are the few choices that we can make to have healthier lifestyles. I try to keep soda out of the house. I don't buy juice because if I buy a gallon of juice, they're gonna drink a gallon of juice. So, the choices that we make definitely affect our lives long term. Really, really important. If is anybody, tell me what you have for breakfast this morning.
Boiled egg and a banana.
Boiled
And a
egg.
cup of coffee.
All right, so boiled egg, banana, a cup of coffee. Tell me what you have for breakfast this morning.
Hot milk and a glass of milk.
Okay, I'm behind you.
Strawberries.
Okay. Come on, give me a few more people. Breakfast this morning.
Oh God, all the wrong things.
Just tell me what you had.
Pork sausage, scrambled egg with cheese. What else? Juice.
Good. Kashi Heart Share cereal.
Okay, okay.
I had green tea, fresh squeezed orange juice, whole grain croissants,
Okay.
and some flaxseed with cornflakes.
All right, all right. So, yes, we don't have to have all the healthiest, meals throughout the day, but at least you can make some kind of choice, whether it's the breakfast, the lunch, or the dinner, to include your whole grains, to include your fruit, include your vegetables, include your proteins. I was a vegan for about 9 months, and it was difficult because I wasn't a label reader. And being a vegan, I had to read a lot of labels. And I'm telling you, I used to just go into the store and pick up, now I had to see if something had milk in it or if something had eggs in it because, I couldn't eat it. However, I lost 40 pounds doing that. It was 9 months, but it was 40 pounds. So the choices that you make, definitely, I don't know why I stopped. I'm going to try to get back to you. But the choices that we make definitely affect our health. I know a few people in here probably have family members who are either diabetic or have high blood pressure or high cholesterol. So, eating healthy foods, the fruits, the vegetables play an important part in the children's lives. So, just try to make as healthy choices as you can throughout the day. Like I said, I'm not here to tell you what you can and can't eat because you're gonna make the choices you're gonna make when I leave here. But definitely try to keep some things out of the house if you can, and only drink soda when you go to a restaurant every month. Don't bring it in the household, just so you can try to keep that weight down, and not just weight, keep the sugar low, not low, but keep it within normal limits. Keep that pressure down, because we want to live longer, healthier lives. So very, very important. I'm going to speak a little bit about breastfeeding also. Really, really important. A lot of WIC gives out formula, and I know a lot of people know about WIC and giving formula out. However, we do have breastfeeding peer counselors, and we do have women who only breastfeed. They don't give formula at all. Formula is, made in a warehouse somewhere. It's manufactured. It's not human milk, which is species specific. So human milk to a human baby. Babies digest it easily. It has all those antibodies and anti-infectives and, all the things that build and keep your immune system strong. So if you know anybody who needs help with breastfeeding, we help with breastfeeding. We don't just give out formula. We help with breastfeeding also. We give out electric pumps. We give out manual pumps. Yes, if you want formula, we can help you with formula also, because everybody doesn't have, make the choice to breastfeed, or some people cannot breastfeed. We understand that, but really, really important. Anybody in the community who does want to breastfeed, they can come on down to us at WIC. We do give out food, and, we try to give healthy choices. So let me just run down some of the things that we do give. They give, instead of whole milk now, because a lot of people were used to just getting whole milk, it's low-fat milk. So it's only 1% or fat-free. That's it. Unless, you're 1 year old, then we give whole milk just for that first year. We give out tortillas. We give out whole grain bread. We give out brown rice now. People who were on the program years and years ago, they don't remember all of this stuff because this is new. So, we're starting to give out more healthy choices. We give money for fruits and vegetables. And yes, there is a farmer's market, and there's a farmer's market that goes on in Roosevelt during the months of July through October. I think it runs through October. So there is a farmer's market in the neighborhood. They have one in Freeport also. And then they have a few around the area. I think they have Rockville Center, they have Long Beach. So there's a few places you can go for the farmer's market, but there's one right in this community on Nassau Road on Sundays. So if you, right in the parking lot of 380 Nassau Road. Right in the parking lot of 380 Nassau Road. So, come on down and support the local farmers, and no, this market is not an organic market, but it does have, your fresh fruits and vegetables. What'd you say? Yeah. And that's true. You have to get down there early because sometimes it's gone by the time you get there. So, and another thing, in the grocery store, so your local grocers, if you see some funky looking fruit and vegetables, let them know so they can know that we demand better, and they can go out and get things that don't look, edible and don't look fit for purchase. Let your grocers know that you demand better service, and everybody has to definitely group together and try to get, these grocers to listen.